See,
So what kind of situation do we have with this patient?
this young gentleman suffered an elbow while playing soccer to the forehead, and he fractured the front of his frontal sinus here. Fortunately, there's no intracranial involvement, and so really what he needs for this contour irregularity over here is to have an operation to bring the bones back out into a normal contour.
So he's
with some
missing
small
bone
plates.
there?
No, the bone has been crushed in the front part of the sinus.
I see.
The sinus is functioning well, which is good, and there's no intracranial involvement. So really, it's just repairing these bones in the front here, so that he has a normal contour of the forehead. Otherwise, this will continue to contract, and we'll end up with quite a large defect in the forehead. So we're planning to do a surgery for him, which will involve shaving some of the hair here and making an incision over here that the scar will be hidden in his hair later on as the hair grows back. And we can peel the scalp off and the forehead skin off, get to the bones in the front here, and then go ahead and reduce them and plate them to put them into a normal contour, and then just pull his hair back up and close up shop, and he should be fine.
And then, so what would happen if he didn't have this kind of operation?
He would have to live with a large defect in the front of his forehead, a big depression here.
So a big, and then is that just covering his brain, or what's behind that?
No, behind that is the frontal sinus, one of the sinuses of the head, and behind that is the brain. He's fortunate in that the backbone, the bone on the backside of the sinus wasn't fractured, so there's no involvement of the actual intracranial cavity. And the sinus itself is draining quite nicely into the nose, and so we don't have to worry about a backup of mucus fluid, which could cause an infection in this area and infect his brain. So it's good. It'll be a nice operation, pretty quick. It'll correct the problem for him, and his recuperation as a young boy will be very rapid.
Very good.
He just has to grow some hair back.
Very good.
Okay?
Thank you.
All right.